messages with the community about the spread of COVID-19. We have several speakers for today. We'll start with Dr. Marshall Runge, who is the CEO of Michigan Medicine. Dr. David Miller will follow. He is the president of the University of Michigan Health. Dr. Erica Newman, who is a pediatric surgeon at C.S. Mott Children's Hospital, will follow her. We'll follow Dr. Miller. Then we will go to Luann Ewald, who is Chief Operating Officer for C.S. Mott Children's and Von Voigtlander Women's Hospital. And finally, Lorraine Washer, who is U of M Health's Medical Director of Infection Prevention and Epidemiology. For the media who have joined us, we will allow for some questions and answers at the end of the press conference. You will need to type your question into the chat box. With that, I'm going to turn it over to Dr. Runge.
Thank you, Mary. And thank all of you for joining us. At Michigan Medicine and across our state, healthcare is truly in a crisis as this highly contagious Omicron variant is really stressing our resources to the limit. Rising COVID cases in children and adults, combined with staffing shortages, have overwhelmed Michigan Medicine resources. And I implore all of you and all the people in Michigan to get vaccinated. And for parents of children who are eligible for vaccination, please have your children vaccinated. Although Omicron infections tend to be less severe and perhaps cause fewer serious COVID cases, it's the sheer number of people infected by Omicron that is overwhelming our resources. Hospitalizations are rising rapidly, and once again, we and other hospitals are having difficulty delivering needed care for other patients who have serious but non-COVID illnesses. We've had to reduce our surgical volume, putting off life-improving and in some cases life-saving procedures. At the same time that more children and adults are getting sick, so are many of our staff. Through our contact tracing, we know that staff members, like the rest of the country, are acquiring COVID from interactions with family and friends over the holidays and in the new year. This staffing shortage is the most serious we have ever seen. A key marked difference between the Delta variant and Omicron is that COVID infection from Omicron is occurring at a much higher rate in children. As you'll hear from our pediatric specialists in a few minutes, Omicron is resulting in many more hospitalizations in children as well. And as with adults, this is mostly in unvaccinated children. Michigan Medicine has always been a resource for the entire state. However, at present, we're not able to accept most requested transfers of truly critically ill patients, whether they be adults or children, because we simply don't have available intensive care unit beds. And when we do have a bed available, we can't always utilize that bed due to the shortages of healthcare providers needed to staff these intensive care unit beds. These decisions in the day-to-day grind of caring for so many seriously ill patients has taken a toll on our clinical staff. These dedicated professionals are working long hours through the most difficult of circumstances and the most difficult of their career to care for the sick and to save lives, but they're exhausted, both physically and emotionally. Most importantly, this is a heartbreaking situation, especially given the fact that we do not have to be where we are today, because proven vaccines that reduce the severity of COVID-19 or completely prevent illness are available. We need everyone's help to curb this surge and reduce the severity of illness by being vaccinated. So today we're reaching out to the public as broadly as possible, live streaming this press conference over YouTube and social platforms, and launching messaging on digital billboards across Southeast Michigan. It's up to all of us. Wear a mask, get vaccinated, and stay strong. I'll now turn to Dr. David Miller, the president of the University of Michigan Health, to provide further insights into the current status of the pandemic.
Thank you, Dr. Runge. As Dr. Runge indicated, we're deeply concerned about rising cases among both children and adults in our state. And today it's important that we share with you how challenging the situation is here at Michigan Medicine, as well as for hospitals and health systems across the state. In the state of Michigan, we're continuing to see record numbers of hospitalized COVID-19 patients. And we don't expect this to begin to decrease for at least another week. And even this timing remains uncertain. In the last week at Michigan Medicine, we've had our highest ever number of patients who are 17 or younger in the hospital. Earlier today, that number was 11. We need your help. And first and foremost, we need more children and more adults to be vaccinated. As you can see in this graphic, the majority of patients hospitalized with COVID-19 are unvaccinated, including the vast majority of patients with COVID-19 in the ICU at Michigan Medicine. We also need your help because the rising number of cases is impacting every aspect of our clinical care. We've canceled or postponed more than 250 surgeries since this surge began in December because we've needed the hospital beds for kids and adults who are coming down with serious cases of COVID-19. What this means is that many people are not receiving potentially life-saving care because Michigan Medicine and other hospitals are full. And these are patients who've often rearranged their lives to be prepared for a necessary and often life-saving intervention. We're also greatly limited in our ability to accept patients and transfer from other hospitals across the state. Again, reducing access to highly specialized services available at Michigan Medicine. Our emergency department also continues to run at full capacity almost constantly. And this is not how we or anyone else wants to receive or deliver healthcare. Even so, I want to stress that those who need emergency care should not stay at home. If you have an illness or an accident that threatens your life, your limb, or your organs, please seek out emergency care. Our doors are always open. But if your symptoms aren't that severe, we need your help. Please consider options other than the emergency department that may be available to you, including calling your physician or making an appointment, scheduling an e-visit, or visiting urgent care. And please remember, the emergency department should not be used as a testing site. We are so busy taking care of patients, and as Dr. Runge mentioned, at the same time, Michigan Medicine team members are also vulnerable to the spread of this disease. We've had 739 employees test positive for COVID-19 since January 1st. We need our caregivers to be healthy and ready to care for our community. And we're concerned about the impacts of staffing shortages for the well-being of both our patients and our team members. To protect our patients and our employees, effective tomorrow, we are implementing a 2-week pause on visitors to our adult hospitals. We're doing this because the Omicron variant is so easily transmissible and because so many people are asymptomatic. People visiting their loved ones may unknowingly be passing on the virus. And this isn't an easy decision. We recognize the importance of visitors for our patients. But right now, we believe that pausing visitors is the safest step for our patients, especially those who are in semi-private rooms, as well as for our team members. There will, of course, be exceptions allowed when a family caregiver is considered critical, as determined by the nursing unit. In our Mott Children's Hospital, we are keeping the policy of allowing the same 2 visitors per patient. Our visitor policy for our ambulatory clinics will remain unchanged. Our website, uofmhealth.org, always has the latest information on Michigan Medicine visitor policies. I want to take this opportunity to thank our teams at Michigan Medicine. Our teams are being tested every day, but they still come together to support one another to provide compassionate, top-notch healthcare to our patients. Thank you to each and every member of our Michigan Medicine team. Finally, on behalf of our extraordinary teams, we need your help. Let's take some simple steps together, socially distance whenever possible, wear a mask indoors, and above all, get vaccinated and boosted. Thank you. Now I will transition to Dr. Erica Newman, who can talk more about the effect on our state's children.
Thank you, Dr. Miller. We are deeply concerned about children in our state and in our community and our ability to take care of both children with COVID and non-COVID conditions. We have never seen this many children hospitalized with COVID-19. We are seeing younger kids and teens with COVID-related respiratory illnesses, pneumonia, and a serious COVID-related complication. It's called myocystic inflammatory syndrome, or MIS-C. Our current pediatric COVID hospitalization number has more than doubled since the surge started in December. We are seeing some of the highest numbers that we've ever seen in children. And this is a national trend. The CDC announced last week that pediatric hospitalizations are the highest rate compared to any point during the pandemic right now. And rates are increasing for babies up to 4 years old who really aren't currently eligible for vaccination. The influx of pediatric patients, coupled with staff shortages, has created really a perfect storm, and we're extremely worried about running out of pediatric beds. Our pediatric long-haul COVID clinic also continues to see kids and teens with long-lasting COVID symptoms following even minor infections, preventing them from regular activities like school and sports. We know more children need to be vaccinated. About half of kids ages 12 to 18 and less than a fourth of kids ages 5 to 12 have received a COVID vaccine. Our kids are going to school and participating in activities. This is good for them, but they are exposed to risk. We need to protect them with vaccines and masks and the ability to social distance so that they can experience normalcy again in their childhoods. We also ask that you think about the most vulnerable kids in our communities, a child with cancer, one who has recently had an organ transplant, or those under 5 who can't get vaccinated. We as a society must protect our children. Not getting vaccinated hurts us all, and this disease is spreading and making our children sick. The vaccine is safe. It's effective for your kids. Please don't hesitate to get them vaccinated. I will now turn over to my colleague, Dr. Luann Ewald, Chief Operating Officer of our CS Mott Children's and Von Voigtlanders Women's Hospital.
Thank you, Dr. Newman. As the leader of CS Mott Children's Hospital and Von Voigtlander Women's Hospitals, and with decades of experience in Michigan's pediatric hospitals, I am very worried. There's a very real chance that we won't have enough beds to care for these critically ill children if the spread of Omicron continues to increase. As we know, specialized care for pediatrics and children is not available in all parts of Michigan, and we serve as that resource. We have had a tremendous jump in the number of kids testing positive in our emergency department, up to 18% last week. To put that in context, that number was around 3.5% in early December. Most of the children who test positive in the community come to our emergency department with symptoms of COVID-19. There are some kids that are here for other reasons without COVID-19, and while they're here, they happen to test positive as well, but that is not the majority of cases. Children rely on adults to protect them. Parents, please vaccinate yourselves and your children if they are old enough to receive the vaccine. This is a population that is extremely vulnerable to this surge. There are only a few places in the state that can handle specialized pediatric care. We are struggling, and we are struggling with the volume of cases in addition to the staff shortages, and we do not want this to get worse. We are also concerned about the increased cases in pregnant women that could result in increased premature births. The safest option for pregnant women, for themselves and their babies, is to please get vaccinated. I would now like to introduce Dr. Lorraine Washer, hospital epidemiologist for University of Michigan Health. Dr. Washer.
Great. Thank you, Luann. The risk of your exposure to COVID-19 as you go about your everyday activities is extremely high at this time because of the substantial number of people with COVID infection in Michigan. This includes a 7-day rolling average of over 16,000 new infections daily reported in Michigan. This Omicron variant of COVID has spread throughout Michigan at striking speed, resulting in positivity rates of 39% among our symptomatic patients at Michigan Medicine, and 8% among those who are not symptomatic, but who happen to be tested prior to procedures or admission to our hospital for other reasons. As Dr. Miller stated, the majority of patients with COVID in our hospital are not vaccinated. And in fact, only a small number of the vaccinated patients hospitalized for COVID have had booster doses. We know that individuals who are up to date with COVID vaccination, including a booster shot, are much better protected against severe illness, hospitalization, and death from COVID. I cannot stress enough the importance of vaccination, including that booster dose, to everyone in eligible age groups. Vaccination is important whether or not you've had prior COVID infection. Reinfection occurs much more commonly with Omicron, and natural immunity after infection is not reliable protection. I also want to emphasize that we are providing therapeutic treatments to outpatients when we can, but monoclonal antibodies and these new oral antiviral drugs like Paxlovid are in very, very limited supply, and they are not a substitute for vaccination. So what should we be doing during this surge? In addition to making sure you and your family are up to date with COVID vaccinations, we all need to wear masks, and we need to wear them consistently whenever we're outside our home in indoor public places. You should consider upgrading to a medical mask, such as a medical ear loop mask or a K95. They offer more protection than a cloth mask. In addition, masking is especially important for those who are leaving isolation or quarantine before day 10. While the CDC and the Michigan Department of Health has recommended that the general public can leave isolation or quarantine at day 5 if they are asymptomatic or their symptoms are improving, they still have the potential of continuing to spread the virus as long as 10 days after infection, and should wear a mask around others, including when they are at home around family members. If you have symptoms, you should assume you have COVID. You need to isolate and get tested. PCR tests are most accurate, but take a longer time to get results. Rapid antigen tests are less sensitive, but these results are available quickly and can be administered at your home. If you have symptoms, any positive test means you have COVID. If you have symptoms and your rapid antigen test is negative, you should remain isolated and repeat the antigen test in 36 to 72 hours per the manufacturer's instructions, or obtain a PCR test. I'll also say that it's time to limit your activities if you can, at least for the next several weeks. Don't go to large gatherings, wear masks at small gatherings, avoid places such as restaurants where you may need to be unmasked around others. And now is not the time to let down your guard and get infected because you believe it's inevitable that you'll be infected anyway, or to get it over with, or because you perceive your risk of severe disease as low. As we've stated, our health systems are overburdened, and depending upon your risk factors and your vaccination status, you may develop severe disease. In addition, infection with COVID may result in long-lasting COVID symptoms that can include foggy thinking, fatigue, muscle aches, and other pain symptoms. We don't know enough about the lasting effect of this disease. We have established a long COVID clinic here at Michigan Medicine to help care for patients and to study this entity in more detail. While we hope that we will soon hit the peak for this surge and anticipate that we will see some decrease in case numbers by later this month, if the residents of the state of Michigan can help us by assuring that you are up to date with COVID vaccination, wear your masks, and isolate with symptoms or quarantining after exposure if you're not up to date with vaccination, we can weather this COVID-19 storm together. And now I think I'll hand this over to Mary Mason, who will take questions.
Thank you to all of our panelists. I'll just remind our media colleagues that if you have a question, you can type it into the Q&A function. We have one question from Kim Craig at WXYZ. Her question is, some hospitals in other parts of the country are allowing employees to continue working even if they have tested positive for COVID. Is U of M considering the same? Dr. Miller, I think that would be a good one for you to answer.
Thanks, Mary. And I'll ask Dr. Washer to also join for this answer. So the question relates to ultimately to the high impact of this surge of the pandemic on our team members. And as I mentioned, 739 of our employees have tested positive since January 1st. And we need our remarkable team members to help us provide care for patients who are presenting to our emergency departments or requiring non-COVID care. And so with that level of impact, the question has become, what are the best and safest guidelines to allow both maintaining safe levels of staffing while also ensuring that we're minimizing risks in the healthcare system? And that's a balance based on the staffing level. And so there are different levels. There's conventional staffing, contingency, and crisis. And the CDC guidelines that have recently been released provide a foundation for thinking about differing criteria for returning to work. Currently at Michigan Medicine, for us, for affected or healthcare workers who've tested positive or had exposure, it's 10 days awaiting patients to be asymptomatic with a 10-day time frame before returning to work. We are looking at the possibility of modifying this given the high impact among our healthcare workers and considering other options, including 7 days and the potential role of antigen testing. And I'd like to ask Dr. Washer to also provide some additional detail, because these criteria are based on what we know about transmissibility of the virus over time.
Great, thank you, Dr. Miller. So as you know, the conventional isolation period for COVID, those who've been infected with COVID, has been 10 days. And it's been that way for much of the pandemic. For much of the general public, the CDC and the Michigan Department of Health and Human Services has advised that strict isolation can be limited to a 5-day period as long as that person is asymptomatic or has minimal symptoms and is improving. In the healthcare setting, we have more concern about shorter durations of isolation and have continued to stay at that 10 days of isolation. But as Dr. Miller noted, we may need to go in the future to a shorter isolation for our healthcare workers for return to work. We believe that this can be managed in a safe manner if we need to do so. And the reasons are that most of the transmission that occurs with COVID-19, that is spreading the disease from one person to another, occurs either in the day or two before symptoms develop or in the first 5 days of time that a patient has developed symptoms or has been tested. If we couple that with strong masking, with high quality masks, we can limit the further low amount of transmission that might occur from those days between day 5 and 10. So this is what the general public is being advised to do and why the general public is being advised to do this. And if our staffing constraints become to a point where we need to make these changes, we will use the same rationale to balance the risks, the risk of transmission with the risks of not having enough healthcare workers to provide care.
Thank you, Dr. Washer and Dr. Miller. The next question I have is, what is the current ICU capacity for both pediatric and adults? And maybe Dr. Miller, you can just provide some context around how much room we have in the hospital.
Thank you, Mary. I think our ICUs are very busy. And when we think about the balance of care for patients with COVID and patients with other conditions, that has been one of our guiding principles throughout the pandemic. And presently, when you look at our ICU occupancy in our adult hospitals, and I'll ask Luann Ewald to comment for Children's Hospital, as of this morning, we have approximately 8 to 10 beds available in our ICUs, which represents less than 10% of our overall capacity. And we need to keep beds available both for surgical care as well as for escalation of care within our hospitals. And so we are limited in ICU capacity, having to preserve the small number of beds we have available for escalation of care within our own system, which, as I mentioned previously, has impact for our ability to accept transfers from other hospitals. So I'll ask Luann to please comment for our Children and Women's Hospital.
Thank you, Dr. Miller. Yes, as of this morning, our cardiac ICU was 100% full, and our pediatric ICU, we had 2 beds left out of 23. So that was as of this morning. My guess is that both of those ICU beds are full at this moment. So we are, as I stated earlier, we are reaching capacity in our ICU levels.
Okay, thank you. A follow-up question, and Dr. Miller, I know you mentioned this before, but maybe it bears repeating. How many surgeries have been canceled, and how many children are currently hospitalized with COVID? And can we specify how many are on ventilators, or maybe you can provide some context around whether or not that's important?
Thank you, Mary. I'll start, and I'll ask Dr. Newman and Luann Ewald to also offer perspectives for pediatric ICU care. So the first question was related to how many surgeries have been canceled or postponed. And as I mentioned, since December 1st, we have canceled or postponed at least 250 surgeries across Michigan Medicine. But the reality is that the impact has been larger than that. Even going back to August, when the initial Delta surge started, we reduced our level of scheduled activity below our baseline, which means that we weren't scheduling as many procedures as we typically have starting in August, and that has now persisted over several months. So there are many patients whose care has been postponed. There are patients whose surgeries have been canceled. And as I mentioned, these are often procedures where patients and their families have scheduled their lives around this necessary care only to have their surgeries canceled because we just don't have the bed. So this has been a significant impact for our patients, for our team members, and many heartbreaking decisions. For the pediatric patients, I'd ask Dr. Newman and Luann Ewald, please, to share perspectives on impact on pediatrics, including pediatric ICU care.
Thanks, Dr. Miller. I'll just say for pediatric surgeries, last week, I think the last quote, and in fact, as of now, about 30 to 40% of patients that are presenting to have their operations have been testing positive for COVID. Hence, we're needing to cancel those cases. And so that's a loss not only for those patients needing to have their operations, but it's also a loss of our operating room time and staffing as well. So we're seeing it on both ends, both patients that are presenting, kids that are presenting symptomatic, and then those that are presenting without symptoms that are testing positive just before their surgeries and needing to cancel.
Yes, and the only thing I would add is that the surgeries that have been canceled, we are trying to reschedule those as soon as we can, but when we have the perfect storm of not enough ICU beds to care for these kids after their surgeries, and when we have so many staff that are out with COVID, we are continuing to delay surgeries as well.
Thanks. I have another question. Do you have a waiting list for monoclonal antibodies? How long is that waiting list? And Dr. Washer, maybe you can talk a little bit more about those therapeutics.
Okay, thank you. So the monoclonal antibody currently available is sotiramab. It's the only one that is available and is effective against Omicron. It is, however, an incredibly short supply across the country and the state, and we are allocated amount of product by the state health departments. And so we do have fewer doses of monoclonal antibody than we have individuals who might qualify for that. And as a result, it is not always possible for everyone who might qualify for monoclonal antibody to receive it, in particular to receive it in the required time within 7 days of onset of symptoms. We do prioritize monoclonal antibody therapy for those who are immunocompromised. They may have higher risk of severe disease, and they may have less ability to respond to vaccines with immunity. Other groups that may qualify for monoclonal antibody are those who are over age 75 and are not maximally vaccinated, or pregnant women who are not maximally maximally vaccinated. So it does take, we do get referrals for monoclonal antibody from our clinicians and our providers. And we have a team of pharmacists and other physicians who review that list and contact patients. They offer as many people drug as we can get a hold of. I don't know how long the waiting list is, if you will, or how many days until someone will be able to get a monoclonal antibody when it's available. But it is a very strictly limited resource at this time. Other treatments for outpatients with COVID include new oral antivirals. And these two have limited indications for who qualifies for them. And they are really only available after being prescribed by your physician, meeting the criteria that the state has put out, and they are only available at Meijer pharmacies, specifically in the Southeast Michigan area. And for Paxlovid, which is the preferred antiviral, it is only available currently at 10 select Meijer pharmacies. So really, really important for people to do the pre-exposure, the pre-infection work to get vaccinated, to decrease the risk for severe disease. These monoclonal antibodies, these antivirals, are very limited in supply. They are hard to get a hold of.
Okay, thank you all. It looks like we've answered most of the questions that have been typed into the chat. If you have a question that was not answered, please feel free to email me, mfmasson@med.umich.edu. That's MFMASSON. I'll be happy to follow up with any answers. We really appreciate your attendance at today's conference. And thank you again for all you do to help us get these messages out to the public. Have a great afternoon.